Hi, so this is my next practice video that I'm going to upload. I decided to cut some out because I chit chat way too long and it was a little long per usual for me. So anyways, I'm going to kind of start up. I crop some out and I'm going to say the last body piece and conclusion. So now that I have explained the main qualifications to become a candidate for physician-assisted suicide, which is a possible solution, as well as economical benefits, I will continue to convince you that this practice is a good idea by discussing the implementation of physician-assisted suicide. All of the states that have legalized this have similarities in their protocol according to the state-by-state guide to physician-assisted suicide. In order to be eligible, patients must be of 18 years of age or older. They must be a resident in that state. The patients must be capable of making and communicating healthcare decisions by him or herself, as well as having been diagnosed with a terminal illness that will lead to death within 6 months. The attending physician must also be licensed in the same state as the patient. The physician diagnosis must be certified by consulting a physician, and attending physician must notify the patient's next of kin of the prescription, among a few other rules. And in addition, patients must have 2 oral requests at least 15 days apart, followed by 1 written request. This is all information that can be found in the state-by-state guide to physician-assisted suicide. If the patient is willing to put forth as much effort as they are with their request, there should not be any law against how they wish to end their suffering. In addition, patients' families are okay with the procedures, so I don't see any reason why this should be prevented. Today I've demonstrated the need to legalize physician-assisted suicide with the use of real-life examples of people in this horrible situation that need physician-assisted suicide. I've also explained the qualifications needed in order to undergo physician-assisted suicide, as well as the cost benefits, and lastly, the implementation of physician-assisted suicide in several states that are already successfully practicing. Understanding what those who are tortured with the suffering of terminal illness go through will help you understand the necessity of this law, as it's unpredictable who may end up with a terminal illness and who may end up wishing for this option. Put yourself in a suffering patient's shoes. Imagine how terror-stricken you could feel and how much you wish to put out your misery, and remember that legalizing physician-assisted suicide in other states that do not allow it would result in patients being able to die happy and their family members not having to see them go through this horrible last stage of life that they would face. Consider advocating for physician-assisted suicide.